Helping your baby sleep soundly through the night is a common concern for many parents. Sleep is crucial for a baby's healthy growth and development, and a restful night brings benefits not only to the child, but also to the entire family. While every baby is unique, there are fundamental principles and practical strategies that can help establish healthy sleep habits and create an environment conducive to deep, restorative rest. In this comprehensive guide, we will explore the key elements that contribute to a baby's good night's sleep, including understanding sleep patterns, creating a bedtime routine, optimizing the sleep environment, addressing common sleep challenges, and fostering positive sleep associations. To begin, it's important to understand the basics of baby sleep. Newborns have very different sleep patterns compared to adults. In the early weeks of life, babies sleep in short bursts, waking frequently to feed. As they grow, their sleep cycles gradually lengthen, and they begin to organize their sleep more at night and wakefulness during the day. By around 3 to 6 months, many babies start sleeping for longer stretches at night, though it is normal for some to continue waking up. Understanding that sleep is a developmental process helps parents set realistic expectations and respond with patience and flexibility. One of the most effective ways to help a baby sleep through the night is to establish a consistent bedtime routine. Babies thrive on predictability and routine, as it signals to their developing brains that it is time to wind down and prepare for sleep. A soothing bedtime routine can include activities such as a warm bath, gentle massage, changing into comfortable pajamas, dimming the lights, reading a short story, or singing a lullaby. These calming activities, repeated in the same order each night, help condition the baby's mind and body to transition from the stimulation of daytime to the peace of nighttime rest. Pay close attention to your baby's sleepy cues. Yawning, rubbing eyes, fussiness, or staring off into space are signs that your baby is tired and ready for sleep. Trying to put your baby to bed when they are overtired can actually make it harder for them to fall asleep and stay asleep. On the other hand, putting your baby down while they are drowsy but still awake helps them learn to self-soothe and fall asleep independently, a crucial skill for sleeping through the night. The sleep environment plays a significant role in promoting uninterrupted rest. The baby's sleep space should be quiet, dark, and comfortably cool, ideally between 68 to 72 degrees Fahrenheit. Blackout curtains can help block out external light, while a white noise machine or a fan can provide gentle background sound that masks household noises and creates a soothing atmosphere. Ensure your baby's crib or bassinet is free from pillows, blankets, stuffed animals, or loose bedding. As the American Academy of Pediatrics recommends a bare sleep surface to reduce the risk of suffocation and sudden infant death syndrome, CDS. A firm, well-fitting mattress covered with a snug crib sheet is all your baby needs for safety and comfort. Dress your baby in appropriate sleepwear for the season, ensuring they are not too hot or too cold. Overheating is a known risk factor for SIDS, so avoid heavy blankets or overdressing. If you worry about your baby getting cold, consider using a wearable blanket or sleep sack designed for infants. Feeding plays a crucial role in your baby's sleep patterns, especially in the early months. Newborns need to feed frequently, including during the night, to support their rapid growth. As your baby gets older and their stomach capacity increases, they may be able to go for longer stretches between feeds. If your baby routinely wakes at night for feeds, try to keep nighttime feedings calm and low-key. Use a soft voice, keep the lights dim, and avoid stimulating activities. This helps reinforce the difference between night and day and encourages your baby to return to sleep more easily after feeding. As your baby gets older and begins to sleep for longer stretches, you can gently encourage them to drop night feedings if they are developmentally ready. Gradual approaches, such as reducing the amount of milk offered at night or gently patting and soothing your baby instead of picking them up immediately, can help them learn to settle back to sleep on their own. However, always consult your pediatrician before making significant changes to your baby's feeding or sleep routines, especially in the first year. Daytime routines are just as important as nighttime routines when it comes to healthy sleep. Babies who get plenty of exposure to natural daylight during the day tend to sleep better at night, as this helps regulate their internal body clock or circadian rhythm. Try to spend time outdoors with your baby, especially in the morning. Regular nap times, spaced appropriately throughout the day, prevent overtiredness and help your baby sleep better at night. While it may seem counterintuitive, skipping naps does not help your baby sleep longer at night. In fact, overtired babies often have more trouble falling and staying asleep. Sleep associations are habits or conditions your baby links with falling asleep. Positive sleep associations, such as a favorite lullaby or a gentle comfort item appropriate for your baby's age, can help signal that it's time to sleep. However, if your baby becomes reliant on being rocked, fed, or held to fall asleep, they may struggle to return to sleep on their own if they wake up during the night. Gradually teaching your baby to fall asleep independently, with gentle reassurance and consistency, can help them develop the ability to self-soothe and sleep for longer stretches. If your baby is having trouble sleeping through the night, it is important to consider if there are any underlying issues. Common culprits for disrupted sleep include teething, growth spurts, developmental milestones, illness, or changes in routine, such as travel or moving to a new home. Teething can cause discomfort that makes it harder for your baby to settle, while milestones like learning to roll over, crawl, or stand can temporarily disrupt sleep as your baby's brain and body are busy mastering new skills. During these times, extra comfort and patience are needed. Sleep regressions are another challenge many parents encounter. These are periods when a baby who previously slept well suddenly begins waking more often or resisting naps and bedtime. Sleep regressions are normal and often coincide with developmental leaps or growth spurts. The most common occur around 4 months, 8 to 10 months, and again at 18 months. While these phases can be exhausting, they are generally temporary. Maintaining your routines and providing consistent, loving reassurance will help your baby get back on track. Some parents worry about sleep training, which refers to various methods aimed at helping a baby learn to fall asleep independently. There is no one-size-fits-all approach, and the best method depends on your family's values, your baby's temperament, and your own comfort level. Some families prefer gentle sleep training methods, such as gradually reducing the amount of help you give your baby to fall asleep, while others may choose more structured approaches. The key is to be consistent and responsive to your baby's needs, offering comfort when needed while giving them the opportunity to learn new sleep skills. Safety is paramount when it comes to baby sleep. Always place your baby on their back to sleep, for every sleep, as this position reduces the risk of SIDS. Room sharing. Keeping your baby's crib or bassinet in your room, but not in your bed, is recommended for at least the first 6 to 12 months. Smoking around your baby increases the risk of SIDS, so ensure your baby's environment is smoke-free. Pacifiers have been shown to reduce the risk of CDs, so consider offering one at nap and bedtime if your baby accepts it. It's also important to look after your own well-being as a parent or caregiver. Sleep deprivation is challenging, and it's normal to feel overwhelmed or frustrated at times. Reach out for help from family or friends when you need rest, and remember that your baby's sleep patterns will change as they grow. Be gentle with yourself and seek support from your healthcare provider if you are struggling with fatigue or anxiety. For some families, cultural traditions and beliefs about sleep may influence their approach. In some cultures, co-sleeping or bed sharing is common, while others emphasize independent sleep from an early age. If you choose to bed share, make sure you are fully informed about safe sleep practices to minimize risks. As your baby grows into a toddler, sleep routines and needs will continue to evolve. Most toddlers need around 11 to 14 hours of sleep in a 24-hour period, including naps. Establishing clear boundaries and consistent routines helps toddlers feel secure and understand what to expect at bedtime. Encourage independence by allowing your child to participate in bedtime routines, such as picking out pajamas or choosing a bedtime story. If your toddler is transitioning from a crib to a bed, make sure their new sleep space is safe and inviting. In summary, helping your baby sleep well through the night is a gradual process that involves understanding their developmental needs, creating a peaceful sleep environment, establishing consistent routines, and responding with patience and compassion. Every child is different, and what works for one family may not work for another. By paying attention to your baby's unique cues and needs, you can support their healthy sleep and overall well-being. Remember, it is normal for babies to wake during the night, especially in the early months. With time, gentle guidance, and reassurance, most babies will naturally begin to sleep for longer stretches. If you have ongoing concerns about your baby's sleep or notice symptoms such as persistent snoring, breathing difficulties during sleep, or significant changes in behavior, consult your pediatrician for advice and support. Ultimately, the journey to better sleep is about building trust, security, and comfort for your baby. The loving routines you establish now will not only help your baby sleep more soundly, but also lay the foundation for a healthy relationship with sleep that will benefit them for years to come. If you are looking for practical steps to start improving your baby's sleep tonight, consider the following checklist. 1. Observe your baby's sleep signals and try to put them to bed when they are drowsy but not yet asleep. 2. Keep bedtime and nap time routines calm, consistent, and soothing. 3. Make your baby's sleep environment dark, quiet, and comfortably cool. 4. Ensure the crib is safe with a firm mattress and no loose bedding or soft objects. 5. Use appropriate sleepwear to keep your baby comfortable without overheating. 6. Offer plenty of daylight exposure, and age-appropriate physical activity during the day. 7. Feed your baby as needed and keep night feedings calm and brief. 8. Encourage independent sleep by putting your baby down while they are sleepy but awake. 9. Be patient during sleep regressions and developmental milestones. These phases are temporary. 10. Prioritize your own rest and seek support when needed. By following these steps and adapting them to suit your family's unique needs, you can help your baby develop healthy sleep habits that will support their growth and happiness. Sleep is a journey, not a destination. And with love, patience, and consistency, peaceful nights are within reach for you and your little one.